Assalamu alaikum wa rahmatullah. This is our first lecture in the lower limb anatomy. It will be about the osteology of the lower limb. By the end of this lecture, each student should be able to identify the different features of the hip bone, the femur, the bones of the leg, the tibia and the fibula, the patella, the foot bones and the foot arches, the joints of the lower limb. And the last part of this lecture, we will talk about some clinical correlations. Let us start by the hip bone. The hip bone, also it is called the innominate bone or the coxal bone. This is the lateral view of the hip bone. As you know, it is formed by fusion of three bones, the pubic bone, the ischium, and the ilium. This is the pubic bone, forms the anterior and the inferior part of the hip bone, and this is the ischium, forms the posterior and the inferior part, while the superior part is formed by the ilium. The three bones, the ilium, pubic bone, and the ischium, fuse together at the acetabulum, which is the hemispherical fossa on the lateral side of the hip bone, in which the head of the femur fits. The head of the femur articulates with the acetabulum to form the hip joint. In this slide, we will show the hip bone from the medial and lateral view. In the left side of the slide, this is the lateral view of the hip bone. This is the pubic bone, form the anterior and the inferior part of the hip bone, while the ischium form the posterior and inferior part. The superior part is formed by the ilium. The three bones, the ilium, ischium, and the pubic bone, are articulated with each other at the acetabulum. In the right side of the slide, this is the medial view of the hip bone. This is the pubic bone here, while this is the ilium, form the superior part, and this is the posterior inferior part of the hip bone is formed by the ischium. You can notice that the difference between the lateral and medial view of the hip bone, the acetabulum is seen only from the lateral side. In this slide, we will show the articulation of the hip bones with each other and with the sacrum. This is the hip bone in the right side. It articulates with the hip bone in the left side anteriorly at the symphysis pubis. This is the sacrum. The two hip bones articulated with the sacrum posteriorly at the sacroiliac joint. Here, this is the sacroiliac joint in the right side and the sacroiliac joint in the left side. Now we will talk about the acetabulum. It is the area where the ilium, pubic bone, and the ischium meet each other at the lateral side of the hip bone. This is the acetabulum here. In the lateral side of the hip bone, it is a concave hemispherical fossa in which the head of the femur fits to form the hip joint. This is the inferior margin of the acetabulum in which there is a deficiency. We call it acetabular notch. This notch is bridged by the transverse acetabular ligament. There is a smooth articular surface in the acetabulum. We call it Leonis surface. This surface articulates with the head of the femur. It is lined by hyaline cartilage. Also, there is rough non-articular surface. We call it acetabular fossa. Now we will talk about the pubic bone. The pubic bone has three parts, or consists of three parts. The first part is the body of the pubic bone. The second part, it is the superior ramus of the pubic bone. The superior ramus joins the ischium and the ilium as the acetabulum at the lateral side of the hip bone. And the third part, it is the inferior ramus. The inferior ramus of the pubic bone joins the ramus of the ischium to form the ischiopubic ramus. The two pubic bones articulate with each other at the midline at the symphysis pubis. Now we will talk in details about the pubic bone. This is the body of the pubic bone. The upper border of the body of the pubic bone had a gentle convexity. We called it the pubic crest. The pubic crest It is the site of origin of two muscles, the pyramidalis muscle and the rectus abdominis muscle. Lateral to the pubic crest, there is the pubic tubercle. It is the forward projecting prominence in the body of the pubic bone. The inguinal ligament attached to the pubic tubercle. This is the superior ramus of the pubic bone. In the upper border of the superior ramus of the pubic bone, there is a pectineal line or the pecten pubis. It is the upper sharp ridge that diverges from the pubic tubercle into the superior ramus. It forms part of the pelvic brim and it joins the arcuate line of the ilium to form the pelvic brim. Now we will talk about the ischium. This is the ischium. It has a body. The body of the ischium joins the ilium and the pubic bone at the acetabulum. Ischium has the ischial tuberosity. It is a rough surface for muscle attachment. Also, it has the ramus. We call it the ramus of the ischium or ischial ramus. This ramus joins the inferior ramus of the pubic bone to form the ischiopubic ramus. The inferior ramus of the pubic bone with the ramus of the ischium, the enclosed area, we call it obturator foramen. Then the ischium has a spine that projects medially. We call it ischial spine. In this slide, we will talk about the second bone that forms the hip bone. It is the ischium. This is the lateral view of the hip bone. The ischium lies posterior and the inferior. The ischium is an L-shaped bone. It has a body. This is the body of the ischium. It joins the ilium and the pubic bone at the acetabulum. Also, it has ischial tuberosity. This is the rough area for the muscle attachment. The ischium has a spine that projects posterior and medial. Between the ischial spine and the ischial tuberosity, there is the lesser sciatic notch. Also, the ischium has ramus. We call it ischial ramus. This ischial ramus joins the inferior pubic ramus to enclose foramen. We call it obturator foramen. In the lower part of the slide, this is the medial view of the hip bone. This is the body of the ischium. This is the ischial tuberosity. And this is the ischial spine. This is the lesser sciatic notch between the ischial spine and the ischial tuberosity. You can notice that the inferior ramus of the ischium joins the inferior ramus of the pubic bone to enclose the obturator foramen. In this slide, we will talk about the ilium. It is formed the upper flattened part of the hip bone. This is the ilium. It articulates with the sacrum at the sacroiliac joint. This is the sacroiliac joint in the right side and in the left side to form the bony pelvis. The upper convex margin of the ilium is called the iliac crest. The iliac crest ends anteriorly at the spine. We call it anterior superior iliac spine. Inferior to the anterior superior iliac spine, the ilium has anterior inferior iliac spine. Medially, the ilium has two fossae. This fossæ for attachment of iliacus muscle. Also, the ilium has arcuate line medially. This line joins the pectineal line of the pubic bone to form the pelvic brim. In this slide, we will talk about the ilium from the medial view. This is the anterior superior iliac spine and this is the anterior inferior iliac spine. The inguinal ligament attached to the anterior superior iliac spine while the iliofemoral ligament attached to the anterior inferior iliac spine. Posteriorly, the ilium has posterior superior iliac spine and posterior inferior iliac spine. The upper convex margin of the ilium is called the iliac crest. It lies between the anterior superior iliac spine and posterior superior iliac spine. This is the auricular surface of the ilium for articulation with the sacrum to form the sacroiliac joint. And this is the iliac fossa for the attachment of the iliacus muscle. This is the arcuate line of the ilium. It joins the pectineal line of the pubic bone to form the pelvic brim. This slide shows the ilium from the lateral view. This is the anterior superior iliac spine, and this is the anterior inferior iliac spine. Posteriorly, this is the posterior superior iliac spine, and this is the posterior inferior iliac spine. As we said previously, the upper convex margin of the ilium is called the iliac crest. The iliac crest of the ilium laterally, it has tubercle. We call it iliac tubercle. The iliac tubercle lies 5 cm posterior to the anterior superior iliac spine. The lateral surface of the ilium is called the gluteal surface because it has 3 gluteal lines. This is the anterior gluteal line. Also, it is called middle gluteal line. This is the inferior gluteal line, and this is the posterior gluteal line. The lateral surface is the surface for attachment of the gluteal muscle. Posteriorly, this is the posterior inferior iliac spine, and this is the ischial spine. Between them, there is the great sciatic notch. This slide shows the lateral surface of the ilium. Also, it is called the gluteal surface. This is the iliac crest, and this is the iliac tubercle. It lies 5 cm posterior to the anterior superior iliac spine. The lateral surface of the ilium has 3 curved lines. This is the anterior gluteal line. Also, it is called the middle gluteal line. This is the inferior gluteal line, and this is the posterior gluteal line. The 3 gluteal muscles, the gluteus maximus, the gluteus medius, and the gluteus minimus, arise from the lateral surface of the ilium. Now we will talk about the second bone, the femur. It is the longest bone of the body. It has different parts. It has head, neck, and shaft. Also, it has a greater trochanter and lesser trochanter. The greater trochanter and the lesser trochanter project from the junction of the shaft and the neck. Distally, the shaft of the femur ends in a pair of large condyles. We call them the medial and lateral femoral condyles. This is the anterior view of the left femur. This is the head of the femur. It is a rounded head. The head of the femur is directed upward, medially, and slightly forward. This is the neck of the femur. It connects the head to the shaft. The neck of the femur proceeds upwards, medially, and slightly forward. This is the shaft of the femur. It has a convex anterior surface. This is a greater trochanter project between the junction of the neck and the shaft. And this is the lesser trochanter. Also, it projects from the junction between the neck and the shaft of the femur. Distally, those are the 2 femoral condyles. The shaft distally ends in a pair of condyles, the medial and lateral femoral condyle. This is the posterior view of the femur. This is the head of the femur. You can notice that this blue color that covers the head of the femur, it is the hyaline cartilage. This hyaline cartilage caps more than half of the sphere of the head. The head of the femur articulates with the lunate surface of the acetabulum. This is the neck of the femur. This is the shaft of the femur from posterior view. This is the greater trochanter and the lesser trochanter. The greater trochanter provides an insertion site for many muscles like piriformis muscle, the 2 gemelli, superior and the inferior gemelli, the obturator externus muscle, and other muscles. The lesser trochanter provides an insertion site for the iliopsoas muscle. Distally, those are the 2 femoral condyles, medial and lateral femoral condyles from posterior view. This is the anterior view of the left femur. This is the head of the femur. It is a rounded head. As we said, the head of the femur is directed upward, medially and slightly forward to fit into the acetabulum. In the head of the femur, we will find the fovea capitis. It is a depression or a bit in the medial side of the head of the femur. This fovea capitis for the ligament of the head of the femur. This is the neck of the femur. It proceeds upwards, medially and slightly forward to attach to the head of the femur. Distally, this is the shaft of the femur. It has a convex anterior surface. The anterior surface of the shaft is smooth and rounded. This is the greater trochanter. It projects upwards and backward from the junction between the neck and the shaft of the femur. The greater trochanter provides an insertion for many muscles. This is the lesser trochanter. It projects medially from the junction between the neck and the shaft of the femur. The lesser trochanter has a smooth surface. This surface facing medially. As we said, the lesser trochanter provides an insertion for the iliopsoas muscle tendon. Between the greater trochanter and the lesser trochanter, this is intertrochanteric line. Anteriorly, the area between the greater trochanter and the lesser trochanter has this line called it intertrochanteric line. The shaft ends into a pair of condyles. This is the medial femoral condyle and this is the lateral femoral condyle. Between the medial and lateral femoral condyles, this is the patellar surface for articulation with the patella. This is the lateral femoral epicondyle above the lateral femoral condyle, and this is the medial femoral epicondyle above the medial femoral condyle. This is the adductor tubercle. It is the small prominence at the upper margin of the medial epicondyle of the femur. This adductor tubercle provides an insertion for adductor magnus muscle. This is the anterior view of the right femur, a magnification of the upper half of the right femur. This is the head of the femur, and this is the fovea capitis, a depression in the medial surface of the head of the femur. As you can see, the head of the femur is capped by hyaline cartilage. This is the neck of the femur, proceeds upwards, medially, and slightly forwards. The greater trochanter and the lesser trochanter. The iliopsoas muscle attached to the lesser trochanter. Anteriorly between the greater trochanter and the lesser trochanter, this is the intertrochanteric line. The upper half of the intertrochanteric line from which the vastus lateralis arises, while the vastus medialis arises from the lower half of the intertrochanteric line. This is the shaft of the femur. It is a convex surface. It is smooth and rounded. The vastus intermedialis muscle arises from the upper two-thirds of the shaft from the anterior and lateral surfaces. This is the image for the hip joint, the right hip joint. This is the head of the femur. And this is the ligamentum teres, or the ligament of the head of the femur. It arises from the acetabulum and attached to the fovea capitis. Also, it is called round ligament of the head of the femur. Either you can call it ligamentum of the head, ligamentum teres, or the ligament of the head of the femur, or the round ligament of the head of the femur. This is the neck of the femur. This is anterior view of the left femur. This is the head of the femur. This is the neck and this is the shaft. Distally, those are the two femoral condyles, the medial and lateral femoral condyles. In a standing position, the shaft of the femur passes downwards and medially. This inclination is evident when the femur is held vertically with the two condyles in contact with a horizontal surface. This green line is the horizontal surface. You can notice that the shaft of the femur passes downwards and medially. In the left side of the slide, this is the magnification of the upper half of the right femur. This is the anterior view. This is the head of the femur. This is the neck and this is the shaft. The neck of the femur makes an angle with the shaft of the femur. This angle is called the angle of inclination. This is the long axis of the neck with the long axis with the shaft of the femur. This is the angle of inclination. It equals 125 in adult male. In children or in child, it equals 160. The angle of inclination is widest at birth and diminished until adolescence. The decrease in the angle of inclination is called coxa varus, while the increase in the angle of inclination is called coxa valgus. In the coxa varus, the head of the femur and the neck of the femur become more horizontal, while in coxa valgus, the head and the neck of the femur become more vertical. This is the lateral view of the right femur. This is the head of the femur, the greater trochanter, the lesser trochanter, and the shaft of the femur. This is the medial view of the right femur. This is the head of the femur, is capped by hyaline cartilage. This is the fovea capitis. This is the neck of the femur, the greater trochanter and the lesser trochanter. Between the greater trochanter and the lesser trochanter anteriorly, there is intertrochanteric line. This is the end of the intertrochanteric line. Posteriorly, between the greater trochanter and the lesser trochanter, situated the intertrochanteric crest at the junction of the posterior surface of the neck and the shaft of the femur. This is the trochanteric fossa. In the bottom of the medial surface of the greater trochanter, the trochanteric fossa for the attachment of the obturator externus tendon. This is the quadrate tubercle. It is an oval eminence nearly the halfway down the intertrochanteric crest for the attachment of the tendon of the quadratus femoris muscle. This is the pectineal line or the spiral line. The intertrochanteric line anteriorly, the end of the intertrochanteric line anteriorly continues below the lesser trochanter and runs into the posterior surface of the shaft of the femur as a spiral line or pectineal line. This line for the attachment of the pectineus muscle. This is the magnification of the lower part of the right femur. This is the anterior view of the lower part of the right femur. This is the shaft of the femur. As we said, the shaft of the femur carries at its end the two condyles, the medial femoral condyle and the lateral femoral condyle. This is the lateral femoral epicondyle and this is the medial femoral epicondyle. This is the adductor tubercle. As we said, it is a small prominence at the uppermost part of the medial femoral condyle. The adductor tubercle for attachment of the adductor magnus tendon. This is the patellar surface, lies between the lateral femoral condyle and the medial femoral condyle. Also, it is called the trochlear surface for the patella. You can notice that the lateral femoral condyle projects more than the medial femoral condyle. This projection helping to stabilize the patella. Now let us talk about the posterior feature of the femur. This is the posterior view of the left femur. This is the head of the femur. It is a rounded head. This is the fovea capitis, a depression in the medial surface or in the medial side of the head. This is the neck of the femur, the greater trochanter and the lesser trochanter. Anteriorly, between the greater trochanter and the lesser trochanter, there is intertrochanteric line, while posteriorly, in the posterior surface of the femur, between the greater trochanter and the lesser trochanter, situated intertrochanteric crest. This is the intertrochanteric crest. This is the shaft of the femur. The shaft anteriorly is convex and smooth, while posteriorly the shaft of the femur is concave. In the shaft of the femur, there is a vertical ridge in the middle third of the shaft. It is called linea aspera, it is strong, read at the mid-third of the concave posterior surface of the shaft. This linea aspera diverge superiorly and inferiorly, or diverge above and below. This is the pectineal line or the spiral line. As we said, the intertrochanteric line, the end of the intertrochanteric line continues below the lesser trochanter and runs into the posterior surface of the femur as pectineal line. This is the gluteal tuberosity. Here, the gluteal tuberosity, it is the vertical ridge on the back of the shaft below the greater trochanter. It is a vertical ridge on the back of the shaft below the greater trochanter. The gluteal tuberosity provides insertion for the deep lower part of the gluteus maximus muscle. This is the linea aspera diverge superiorly and medially to become continuous with the pectineal line, and diverge superior and lateral to become continuous with the gluteal tuberosity. Distally, this is the medial supracondylar ridge or medial supracondylar line, and laterally, this is the lateral supracondylar ridge or lateral supracondylar line. The linea aspera diverge below and medial to becomes continuous with the medial supracondylar line, and the linea aspera also diverge below and lateral to becomes continuous with the lateral supracondylar line. This is the medial epicondyle of the femur, and this is the adductor tubercle for attachment of adductor magnus muscle. This is the lateral epicondyle of the femur. This is the medial femoral condyle, and this is the lateral femoral condyle. Between the medial and lateral femoral condyles, posteriorly, there is fossa. We call it intercondylar fossa. Above the intercondylar fossa, there is the triangular area between the medial supracondylar line and the lateral supracondylar line. This is the popliteal surface. The popliteal surface for attachment of popliteus muscle. This is the posterior view of the upper part of the right femur. This is the head of the femur, the fovea capitis. This is the neck of the femur. This is the greater trochanter and the lesser trochanter. Between the greater trochanter and the lesser trochanter posteriorly, there is intertrochanteric crest. Here, this is the intertrochanteric crest. Below the intertrochanteric crest, halfway down the crest, this is oval prominence. We call it quadrate tubercle for attachment of quadratus femoris muscle tendon. This is the linea aspera in the posterior surface of the shaft. It is a strong vertical ridge. This is the linea aspera in the middle third of the shaft. It diverges superior and lateral to become continuous with this vertical ridge, to become continuous with the gluteal tuberosity. Medially, it diverges to become continuous with the pectineal line. This is the pectineal line. It provides an insertion for pectineus muscle, while the gluteal or the gluteal tuberosity, it provides an insertion for the lower part or the lower quadrants of the gluteus maximus muscle. This is the posterior view of the right femur. It is the magnification of the lower part of the right femur. This is the medial femoral condyle and the lateral femoral condyle. Between the medial and lateral femoral condyles, this is intercondylar fossa. Above the intercondylar fossa, this is intercondylar line. This is the medial femoral epicondyle, and this is the adductor tubercle for attachment of the adductor magnus muscle. This is the lateral femoral epicondyle, and this is the medial supracondylar ridge or the medial supracondylar line here, and this is the lateral supracondylar ridge or the lateral supracondylar line. Between the medial supracondylar line and the lateral supracondylar line, this is the popliteal surface or the popliteus surface. It provides an attachment for the popliteus muscle. Now quickly we will revise the different features of the lower part of the femur from the anterior view and from the posterior view. This is the anterior view of the lower part of the femur. This is the right femur. This is the shaft of the femur. This is the medial femoral condyle and the lateral femoral condyle. As we said, the lateral femoral condyle projects more than the medial femoral condyle. This is the lateral femoral epicondyle and this is the medial femoral epicondyle. Above the medial femoral epicondyle, this is the adductor tubercle. Between the lateral femoral condyle and the medial femoral condyle, there is a patellar surface for articulation with the patella. In the right side of the slide, this is the lower part of the femur from the posterior view. This is the medial femoral condyle and this is the lateral femoral condyle. Between them posteriorly, there is intercondylar fossa. Above the intercondylar fossa, there is intercondylar line. This is the medial femoral epicondyle and this is the adductor tubercle. This is the lateral femoral epicondyle and this is the medial supracondylar rib. This is the lateral supracondylar rib. Between the medial and lateral supracondylar ribs, there is a triangular area. We call it the popliteal surface for the attachment of the popliteus muscle. This is the X-ray of the right hip joint. This is the right iliac bone, and this is the sacrum. The iliac bone articulates with the sacrum at the sacroiliac joint. This is the right sacroiliac joint. Inferiorly, this is the obturator foramen. In the lateral side of the hip bone, this is the acetabulum here, in which this is the head of the femur articulate with the acetabulum to form the hip joint. This is the neck of the femur, and this is the greater trochanter, project upwards and backwards, while this is the lesser trochanter, project medially. The junction between the greater trochanter and the lesser trochanter anteriorly, this is the intertrochanteric line here. This is a computed tomography scan of the hip joint. This is the coronal section. As you know, the coronal plane, it is the plane that divides the body into the anterior and the posterior part. This is the body of the fourth lumbar vertebra. This is the left iliac bone, and this is the acetabulum in which the head of the femur fits. This is the head of the femur. This is the neck of the femur. This is the greater trochanter in the left side. This is the lesser trochanter in the left side. And this is the ischial tuberosity. Now we will talk about the bones of the leg, the tibia and the fibula. We will start by the tibia, then we will talk about the features of the fibula from the anterior and the posterior view. Now let us talk about the tibia. This is the right tibia from the anterior view. The tibia, it is a large weight-bearing bone. It has massive upper end and a smaller lower end. The massive upper end of the tibia extended by the medial and lateral condyles, while the smaller lower end having a prominent medial malleolus that projecting distally. Also, the tibia has superior articular surface. Also, it is called the plateau. This plateau surface, or this is superior articular surface for the articulation of the condyles of the femur and the menisci. The tibia had a shaft. The shaft of the tibia is vertical in standing position. It is the triangular in cross section, so it has three borders and three surfaces. The three borders of the tibia: the anterior border, the medial border, also it is called the posterior border, and the interosseous border or the lateral border. It has three surfaces: the medial surface or the subcutaneous surface, the lateral surface, also it is called the extensor surface, the posterior surface, also it is called the flexor surface of the tibia. This is the anterior view of the right tibia. As we said, the upper part of the tibia is large. It is extended by the presence of the medial and lateral condyles. This is the medial condyle of the tibia, and this is the lateral condyle of the tibia. Distally, the lower end of the tibia is small. It has a prominent medial malleolus that projecting distally. In the upper anterior part of the tibia, there is a tibial tuberosity into which the patellar ligament insert. This is the superior articular surface. This area we call it lateral facet in the superior articular surface for articulation with the lateral meniscus and the lateral femoral condyle. This is the medial facet in the superior articular surface for articulation with the medial meniscus and the medial femoral condyle. Between the medial and lateral facets in the superior articular surface, there is two tubercles, the tubercles of intercondylar eminence. This is the anterior border of the tibia. The anterior border of the tibia is sharp above and it becomes blunt below, where it continues with the anterior border of the medial malleolus. The anterior border is prominent and it forms the shin of the leg. This is the medial border. Also, it is called the posterior borders. It runs into the posterior border of the medial malleolus between the anterior border and the posterior border. This is the medial surface. Also, it is called the subcutaneous surface. You can palpate it subcutaneously. The upper part of the medial surface provides an attachment for muscles like sartorius, gracilis, and semitendinosus muscle. Also, it provides an attachment for medial collateral ligament. This is the interosseous border or the lateral border here. This is the lateral border. Between the lateral border and the anterior border, this is the lateral surface or the extensor surface. The interosseous border is sharp border. It provides an attachment for the interosseous membrane. This is the anterior view of the right tibia. This is the magnification of the anterior upper part of the right tibia. This is the lateral condyle and this is the medial condyle. Between the lateral and medial condyle and slightly distally in the anterior surface, this is the tibial tuberosity, as we said, into which the patellar ligament insert. This is the lateral facet in the superior articular surface for articulation with the lateral meniscus and the lateral femoral condyle. This is the medial facet in the superior articular surface for articulation with the medial femoral condyle and the medial meniscus. Between the medial and lateral facets, those are the tubercles of the intercondylar eminence. This is the anterior border of the shaft, and this is the interosseous border. Also, it is called the lateral border between the anterior border and the interosseous border. This is the lateral surface. Also, it is called the extensor surface because it provides an origin for the extensor muscle. This is the medial border of the shaft. Between the medial border and the anterior border, this is the medial surface. In the upper medial part of the medial surface, there is insertion of three muscles, sartorius, gracilis, and semitendinosus muscle. Also, it provides an insertion for the medial collateral ligament. This is a posterior view of the right tibia. Let us see the features of the tibia posteriorly. This is the medial condyle and this is the lateral condyle. In the lateral condyle posteriorly, there is facet for articulation with the proximal part of the fibula. Actually, this facet for articulation with the head of the fibula. Distally, this is the medial malleolus, while distally and laterally, the tibia has a depression for articulation with the distal part of the fibula. Those tubercles of the intercondylar eminence in the superior surface of the tibia or in the plateau surface of the tibia. Articulation between the tibia and the fibula superiorly forms the proximal tibiofibular joint, while articulation between the tibia and the fibula distally forms the distal tibiofibular joint. This is the medial border, also it is called the posterior border. It runs downward to reach the posterior border of the medial malleolus. This is the interosseous border or the lateral border between the medial and lateral borders. This is the posterior surface, also it is called the flexor surface because some flexor muscles arises from this surface. In the upper part of the posterior surface, this is the soleal line. It runs obliquely just below the proximal tibiofibular joint. It runs across the posterior surface to reach the lower part of the upper third of the medial border. Above the soleal line, this is the triangular area. This area from which arises the popliteus muscle. In the middle third of the posterior surface, this is a vertical ridge from which arises the tibialis posterior muscle. Lateral to the medial malleolus posteriorly, there is groove for tibialis posterior muscle. This is the magnification of the posterior part of the right tibia. This is the medial condyle and this is the lateral condyle. This is the medial facet in the superior articular surface of the tibia for articulation with the medial meniscus and the medial femoral condyle. This is the lateral facet in the superior surface or in the plateau surface for articulation with the lateral meniscus and the lateral femoral condyle. Between them, those are the tubercles of intercondylar eminence. This is articular facet for articulation with the proximal part of the fibula. This is the medial border and this is the lateral border or the interosseous border. In the upper part of the posterior surface, this is the posterior surface between the medial border and the interosseous border. In the upper part of the posterior surface runs obliquely the soleal line. It runs from the distal part of the proximal tibiofibular joint. It runs across the posterior surface to reach the lower end of the upper part of the upper third of the medial border. Above the soleal line, this is triangular area in the upper posterior part of the tibia from which arises the popliteus muscle. This is a superior view of the proximal part of the tibia and the fibula. This is the right tibia and this is the tibial tuberosity anteriorly. This is the right fibula. This is the plateau surface or the superior articular surface of the tibia, in which medially we will find the medial facet. This medial facet for articulation with the medial condyle of the femur and the medial meniscus. This is the lateral facet for articulation with the lateral meniscus and the lateral femoral condyle. The medial facet is oval in shape, while the lateral facet nearly circular in shape. Between the medial and lateral facet, there is intercondylar eminence. It is the elevated area between the medial and lateral facets. This intercondylar eminence is grooved anterior-posteriorly to form the medial intercondylar tubercle and the lateral intercondylar tubercle. The medial meniscus attached anterior and posterior to the medial intercondylar tubercle, while the lateral meniscus attached anterior and posterior to the lateral intercondylar tubercle. Now let us talk about the second bone of the leg, the fibula. It is the lateral bone of the leg. It is the non-weight bearing bone. It has head and styloid process. The styloid process projects upwards from the posterolateral surface of the head. Distal to the head there is the neck of the fibula, and distal to the neck there is the shaft of the fibula. The shaft is long and slender. The shaft has three borders and three surfaces. the anterior surface, lateral surface, and posterior surface. Those surfaces corresponding to the compartment of the leg correspond to the extensor, peroneal, and the flexor compartment of the leg, respectively. Distally, the shaft expands into the flattened lateral malleolus. On the medial surface of the lateral malleolus, there is the malleolar fossa. This is the anterior view of the right fibula. This is the head of the fibula. In the medial surface of the head of the fibula, there is an oval or rounded facet for articulation with the tibia. This is a styloid process. It projects upward from the posterior lateral surface of the head of the fibula. Distal to the head, this is the neck of the fibula, and this is the shaft. It is long and slender. This is the lateral malleolus. It is the lower expanded part of the shaft. This is the anterior view of the right tibia and the right fibula. This is the right tibia. Distally, this is the medial malleolus. This is the right fibula, and distally, this is the lateral malleolus. This is the interosseous border of the tibia, and this is the interosseous border of the fibula. Between them, there is the interosseous membrane, and this is the anterior border of the right fibula. Between the anterior border of the right fibula and the interosseous border of the fibula, this is the anterior surface of the fibula. This anterior surface is extremely narrow. This is the lateral surface of the fibula. It lies lateral to the anterior border. This is the posterior view of the right fibula. This is the head of the fibula. Superiorly, this is a styloid process. It projects upward from the posterior lateral surface of the head. Distal to the head, this is the neck of the fibula. And this is the interosseous border of the fibula. This is the posterior border of the fibula. Between them, this is the posterior surface of the fibula. It is much wider than the anterior surface. Distally, this is the lateral malleolus. In the medial surface of the lateral malleolus, this is the malleolar fossa. In the posterior surface of the lateral malleolus, there is the groove for peroneus longus muscle. This is the anterior view of the right tibia and the right fibula. In the upper part of the right tibia, this is the tibial tuberosity. Distally, this is the medial malleolus. In the head of the fibula, there is articular facet for articulation with the tibia, and distally, this is the lateral malleolus. In the right side of the slide, this is the posterior view of the right tibia and the right fibula. This is the soleal line in the posterior surface of the tibia. This is the articular facet for the proximal part of the fibula in the posterior surface of the lateral condyle of the tibia. Distally, this is the medial malleolus, and distally in the fibula, this is the lateral malleolus. In the lateral malleolus, medially or in the medial surface of the lateral malleolus, this is the malleolar fossa. This is the anterior view, shows articulation between the right tibia and the right fibula. This is the right tibia and this is the right fibula. This is the proximal tibiofibular joint. Distally, this is the distal tibiofibular joint. This is the anterior border of the right tibia, and this is the interosseous border of the tibia. In the fibula, this is the interosseous border. Between the interosseous border of the tibia and the interosseous border of the fibula, this is the interosseous membrane. It shows superior aperture for the anterior tibial vessels. Also, it has inferior aperture for perforating branches of the fibular artery. Distally, this is the medial malleolus, and distally and laterally, this is the lateral malleolus. Now let us talk about the patella. This is the anterior view of the knee joint. Superiorly, this is the femur. Distally, this is the tibia, and this is the patella. It articulates with the femur but not with the tibia. Patella, it is the largest sesamoid bone in the body. It lies in the quadriceps tendon. This is the anterior view of the right femur and the right tibia and fibula. This is the femur. Distally and medially, this is the tibia. Distally and laterally, this is the fibula. This is the quadriceps tendon in which the patella lies. This is the right patella. In the upper part of the tibia anteriorly, this is the tibial tuberosity. The quadriceps tendon attached to the tibial tuberosity through this ligament. We call it patellar ligament. The edges of the patella form a rounded triangle. The patella has four borders and two surfaces. It has superior border, we call it the base, and the inferior border, it is the pointed border, we call it the apex. It has medial border and lateral border. The patella has two surfaces. The anterior surface, it is the rough surface, and the posterior surface, it is the smooth articular surface for articulation with the patellar surface of the femur. This is the anterior view of the right patella. This is the anterior surface of the patella. It is the rough surface. Superiorly, this is the base of the patella. This is the superior border. We call it the base. Inferiorly, this is the inferior border. It is the pointed border. We call it the apex. Laterally, the patella has lateral border, and medially, it has medial border. This is the posterior view of the right patella. This is the superior border or the base of the patella. Inferiorly, this is the pointed border, the inferior border or the apex. Medially, this is the medial border, and laterally, this is the lateral border. This is the smooth articular surface here for articulation with the patellar surface of the femur. In the posterior part of the patella, there is non-articular surface. This is small surface distally, it is non-articular surface. This is rough surface. The smooth articular surface is divided by this vertical ridge into two areas. Laterally, this is a broad lateral area, and medially, this is the narrow medial area. Now we will talk about the last part of the osteology of the lower limb. We will talk about the foot. The bones of the foot are the tarsal bones, metatarsal bones, and the phalanx. This is the bone of the foot from the superior view or from the dorsum of the foot. Posteriorly or proximally, those are the tarsal bones. In the middle, metatarsal bones, and distally, those are the phalanx. Tarsal bones are 7 in number. They are the calcaneum, the talus, the navicular bone, cuboid bone, in addition to the 3 cuneiform bones, the medial cuneiform, intermediate cuneiform, and lateral cuneiform. Only one tarsal bone rests on the ground, which is the calcaneum. Tarsal bones in the foot are arranged in two rows, proximal row and distal row. The proximal row comprises the talus and the calcaneum, while the distal row comprises the 3 cuneiform bones, the medial, intermediate, and lateral cuneiform, in addition to the cuboid bone, which is the most laterally, and the navicular bone, which is the most medially. Now we will talk about the arrangement of the tarsal bones in the foot. This is the superior view of the foot. Distally, those are the phalanx. In the middle of the foot, those are the metatarsal bones. And more proximally, those are the tarsal bones. The tarsal bones arranged into two rows. The proximal row comprises the calcaneum and the talus, while the distal row comprises from the navicular bone, cuboid bone, and the 3 cuneiform bones. This is the medial cuneiform, this is the intermediate cuneiform, and more laterally, this is the lateral cuneiform. The calcaneum, it is the largest bone of the foot. It has 6 surfaces, anterior and posterior surfaces, medial and lateral surfaces, in addition to superior and inferior surfaces. In the medial surface of the calcaneum, there is a shelf-like process. We call it sustentaculum tali. It is a large shelf-like process. The sustentaculum tali supports the head of the talus. The posterior surface of the calcaneum forms the prominence of the heel, to which attach the tendocalcaneum or the Achilles tendon. It is the only tarsal bone that rests on the ground. The talus, it transmits the weight of the body from the tibia to the foot. The talus has head, neck, and body. The head of the talus serves as a keystone for the medial longitudinal arch of the foot. The head is supported by sustentaculum tali of the calcaneum. The talus, it is the only tarsal bone without muscle attachment, but there are numerous important ligaments are attached to the talus. Fracture neck of the talus result in avascular necrosis of the body of the talus due to disruption of the blood supply to the body of the talus. Navicular bone, it is a boat-shaped bone. It has a medial tuberosity. This tuberosity is palpable about 2.5 cm below and anterior to the medial malleolus. It gives insertion to the tibialis posterior muscle. The cuboid bone. In the inferior surface of the cuboid bone, there is a deep groove that lodges the tendon of the peroneus longus muscle. The cuboid serves as a keystone for the medial longitudinal arch of the foot. The cuneiform bones, they are the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. They are wedge-shaped bones. The medial cuneiform is the largest one, while the intermediate cuneiform is the smallest one. The wedge shape of the cuneiform bones contributes greatly to the formation and maintenance of the transverse arch of the foot. Tarsal bones. This is the dorsal aspect of the bones of the right foot. Distally, those are the phalanx. In the middle, those are the metatarsal bones. And proximally, those are the tarsal bones. The tarsal bones arranged into 2 rows, proximal row and distal row. This is the proximal row and this is the distal row. The proximal row consists of the calcaneum. It has 6 surfaces. This is the anterior surface here. This is the lateral surface and this is the posterior surface. The posterior surface forms the prominence of the heel. Medially, this is the medial surface. It has a sustentaculum tali. The superior surface of the calcaneum articulates with this bone, articulates with the talus, while the inferior surface of the calcaneum rests on the ground. This is the talus here. It has anterior head. This is the neck of the talus, and this is the body of the talus. The body of the talus articulates with the tibia. The superior surface of the body of the talus articulates with the tibia, while in the medial and lateral surfaces of the body, there is articular surfaces for articulation with the medial malleolus and lateral malleolus. The inferior surface of the talus articulates with the superior surface of the calcaneum. The neck of the talus, and this is the head of the talus. The head of the talus is rests on the tentaculum tali. The head of the talus anteriorly articulates with this bone. It articulates with the navicular. It is a boat-shaped bone. The navicular anteriorly articulates with the cuneiform bones. Laterally, it articulates with the cuboid bone, while posteriorly, it articulates with the head of the talus. This is a cuboid bone here. The anterior surface of the calcaneum articulates with the cuboid. The anterior surface of the navicular articulates with the medial cuneiform, intermediate cuneiform here, and the lateral cuneiform. The medial cuneiform, it is the largest one, while the intermediate cuneiform, it is the smallest one. The talus articulates with the tibia and the fibula at the ankle joint. The lower aspect of the body of the talus articulates with the calcaneum. The head of the talus articulates with the boat-shaped navicular. The cuboid bone lies laterally to the navicular bone. It articulates with the calcaneum posteriorly, and medially it articulates with the navicular. Anteriorly, the navicular bone articulates with the three cuneiform bones, the medial, intermediate, and lateral cuneiforms. The three cuneiforms articulate with the first three metatarsal bones, and the fourth and fifth metatarsal bones articulate with the cuboid posteriorly. Distal to the metatarsal bones, they are the phalanx. This is the lateral view of the right foot. Those are the tarsal bones. Those are the metatarsal bones, the second, third, fourth, and fifth metatarsal bones. Distally, those are the phalanx. In the tarsal bones, this is the calcaneum. This is the lateral surface of the calcaneum. This is the inferior surface here of the calcaneum, and this is the superior surface of the calcaneum articulates with the talus. This is the talus here. This is the anterior surface of the calcaneum. It articulates with the cuboid bone here. And posteriorly, this is the posterior surface of the calcaneum. It forms the prominence of the heel. This is the talus here. This is the body of the talus. This is the neck of the talus, while the head of the talus articulates with this bone. It articulates with the navicular. This is the cuboid here laterally, and this is the navicular bone medially. This is the lateral cuneiform, and this is the intermediate cuneiform. This is the second metatarsal bone. This is the third. This is the fourth, and this is the fifth metatarsal bones. This is the medial view of the bones of the right foot. Those are the tarsal bones from the medial view. Here, those are the metatarsal bones, and distally, those are the phalanx. This is the medial surface of the calcaneum, and this is the posterior surface of the calcaneum. Here, this is the tentaculum tali here. This is tentaculum tali here. It supports the head of the talus. This is the talus here. This is the body of the talus, and this is the neck of the talus. Anteriorly here, this is the head of the talus. It articulates with the navicular, the boat-shaped bone, the navicular bone. This is the medial cuneiform. It is the largest bone in the three cuneiforms. This is the intermediate cuneiform here. This is the first metatarsal bone, and this is the second metatarsal bone. We can see them from the medial view. Now let us talk about the second type of the bones in the foot, the metatarsal bones. They are 5 in number. The metatarsal bone are long bones. Each metatarsal bone has base. The base of the metatarsal bone articulates with the tarsal bone at the tarso-metatarsal joint. The shaft or the body and the head of the metatarsal bone articulates with the phalanx at the metatarsophalangeal joint. The first metatarsal bone has medial and lateral sesamoid bones in its inferior surface, and the base of the fifth metatarsal bone has a tubercle. This tubercle provides an attachment for two muscles, peroneus tertius and peroneus brevis. Metatarsal bones. This is the dorsal aspect of the bones of the right foot. Distally, those are the phalanx. In the middle, those are the metatarsal bones, and proximally, those are the tarsal bones. This is the proximal bone of the tarsal bones. This is the calcaneum and talus, the distal row, navicular, cuboid, and the three cuneiforms. The metatarsal bones are 5 in number. This is the first metatarsal bone. This is the second, third, fourth, and fifth metatarsal bone. Each metatarsal bone has base, body or shaft, and head. Anteriorly or distally, this is the head of the metatarsal bone of the first metatarsal. This is the head of the second, head of the third, head of the fourth, and head of the fifth metatarsal bone. This long part, this is the shaft or the body. Here, this is the shaft or the body of the second. This is the shaft of the third, fourth, and fifth metatarsal bones. Proximally, those are the bases of the metatarsal bone. This is the base of the first metatarsal bone. This is the base of the second. The bases of the metatarsal bone articulate with the tarsal bones at these joints. We call them tarso-metatarsal joint, while distally here they articulate with the phalanx at this joint here, this one, and this one. Those joints are called metatarsophalangeal joints. Here, this is the first metatarsophalangeal joint. This is the second metatarsophalangeal joint. This is the third, fourth, and fifth metatarsophalangeal joint. This is the fifth metatarsal bone. It has this projecting tubercle. We call it the tubercle of the fifth metatarsal bone. This tubercle provides an attachment for peroneus tertius and peroneus brevis muscle. Metatarsal bones. This is the plantar aspect of the bones of the foot, right foot. Distally, those are the phalanx. In the middle, those are the metatarsal bones. And proximally, those are the tarsal bones. This is the calcaneum, and this is the sustentaculum tali of the calcaneum in the medial surface of the calcaneum. This is the talus. This is tentaculum tali supports the head of the talus. Anterior to the talus, this is the navicular. It has tuberosity. This is the tuberosity or tubercle of the navicular bone. Lateral to navicular, this is the cuboid bone. In the inferior surface of the cuboid bone, there is a groove here for peroneus longus muscle. Anterior to navicular, those are the three cuneiform bones. This is the first metatarsal bone. It has two sesamoid bones, the medial and lateral sesamoid bones. Lateral to the first metatarsal bone, this is the second metatarsal bone, and this is the third metatarsal bone, the fourth and the fifth metatarsal bone. Each metatarsal bone has head, body, and base. Distally, this is the head of the metatarsal bone. In the middle, this is the shaft or the body of the metatarsal bone. Proximally, this is the base of the metatarsal bone. The fifth metatarsal bone has a tubercle. This is the tubercle of the fifth metatarsal bone. As we said, it provides an attachment for peroneus tertius and peroneus brevis muscles. Phalanges or phalangeal bone. They are 14 in number. The big toe has two phalanges, the proximal phalanx and the distal phalanx. The rest of the toes, each one has three phalanges, proximal phalanx, middle phalanx, and the distal phalanx. Each phalanx has head, base, and shaft. The base lies proximally, the shaft in the middle, and the head lies distally. The phalanges articulate with each other at the interphalangeal joint. We have proximal and distal interphalangeal joint, while they articulate with the metatarsal bones at the metatarsophalangeal joint. Phalanges. This is the dorsal aspect of the bones of the right foot. Proximally, those are the tarsal bones. This is the navicular bone, the three cuneiform, and this is the cuboid bone. Distal to them, those are the metatarsal bones. This is the first metatarsal bone, the second one, the third, the fourth metatarsal bone, and this is the last one. It is the fifth metatarsal bone. Distal to metatarsal bones here, those are the phalanges. As we said, the big toe has two phalanges. It has proximal phalanx and distal phalanx, while the rest of the toes, the second, third, fourth, and the fifth toes, each one has three phalanges. Each one has proximal phalanx, middle phalanx, and distal phalanx, while the big toe here, it has two phalanges. It has proximal phalanx and distal phalanx. The joint between the phalanges is called interphalangeal joint. This is a proximal interphalangeal joint, and this is a distal interphalangeal joint. The proximal interphalangeal joint here and here and here, here and here. This between the proximal phalanx and the middle phalanx, while the distal here interphalangeal joint, this is the distal interphalangeal joint, and this is the distal interphalangeal joint between the distal phalanx and the middle phalanx. Phalanges. This is the dorsal aspect of the bones of the right foot. Distally, those are the phalanges. In the middle, those are the metatarsal bones, and proximally the tarsal bones. This is the calcaneum, the talus, navicular bone, the cuboid bone, and the three cuneiform bones. This is the first metatarsal bone, the second metatarsal bone, the third, the fourth, and the fifth metatarsal bone. At the metatarsal bones, each one has head, shaft or body, and base. Like the metatarsal bones, the phalanx, each one has head lying distally, shaft in the middle, and base more proximally. This is the joint here between the metatarsal bones and the phalanx is called metatarsophalangeal joint. Metatarsophalangeal joint here between the metatarsal bones and the phalanges, while between the phalanges is called interphalangeal joint. This is the interphalangeal joint here. This is the proximal interphalangeal joint, and this is the distal interphalangeal joint. Arches of the foot. Each foot has three arches, has medial longitudinal arch, lateral longitudinal arch, and transverse arch. Actually, each foot has a half transverse arch. The two foots together form complete transverse arch. The medial longitudinal arch of the foot. This is the medial view of the right foot. This is the medial longitudinal arch. This arch is formed by calcaneum, the talus, the navicular, and the three cuneiform bones, in addition to the first three metatarsal bones. This is the calcaneum, the talus, the navicular bone, the medial cuneiform, intermediate cuneiform, in addition to the lateral cuneiform. Also, the first metatarsal bone, the second metatarsal bone, and the third metatarsal bone. The keystone bone in the medial longitudinal arch is the talus. Lateral longitudinal arch of the foot. This is the lateral view of the right foot. This is the lateral longitudinal arch. This arch consists of the calcaneum, the cuboid bone, and the two lateral metatarsal bones. This is the calcaneum, the cuboid bone, the fourth metatarsal bone, and the fifth metatarsal bone. Those four bones form the lateral longitudinal arch. The keystone bone in the lateral longitudinal arch is a cuboid bone. The transverse arch of the foot. This arch consists of the bases of the 5 metatarsal bones, the wedge shape of the cuneiform bones, and the cuboid bone. You have to remember that each foot has a half transverse arch. The two foot together form complete transverse arch. This is the cross section through the right foot. This is the coronal section. This is the calcaneum and the talus superiorly. This is a navicular bone. This is the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. The wedge shape of those bones contributes greatly to the formation and maintenance of the transverse arch of the foot. Also, the cuboid contribute to the formation of the transverse arch, in addition to the basis of the first metatarsal bone, the second metatarsal bone, the third metatarsal bone, the fourth and the fifth metatarsal bones. The basis of these metatarsal bones contribute to the formation of the transverse arch of the foot. Joints of the lower limb: the hip joint, knee joint, proximal and distal tibiofibular joints, ankle joint, and the foot joint. The right hip joint, it occurs between the head of the femur and the acetabulum. This is the acetabulum and this is the head of the femur. The head of the femur articulates with the leonate surface here. This blue color is the leonate surface of the acetabulum. The type of the hip joint, it is a synovial joint, and the variety, it is the ball and socket. The ball is the head of the femur and the socket is the acetabulum. This is the knee joint from the anterior view. This is the femur superiorly and this is the tibia inferiorly. This is the medial femoral condyle and this is the medial tibial condyle. This is the lateral femoral condyle and this is the lateral tibial condyle. Between them here and here there is articular cartilage. We called them menisci. This is the medial meniscus and this is the lateral meniscus. This is the patella here. It articulates with the femur but not with the tibia. The knee joint is a compound joint. It occurs between the two femoral condyles with the two tibial condyles in addition to the patellofemoral joint. The type of the knee joint, it is a synovial joint, and the variety of it, it is a modified hinge joint. The tibiofibular joint, it occurs between the tibia and the fibula. This is the right tibia anteriorly and this is the right fibula. Proximal articulation between the head of the tibia, between the head of the fibula and the tibia. Here, this joint is called proximal tibiofibular joint. Distal here, the articulation between distal part of the fibula and the distal part of the tibia is called distal tibiofibular joint. The proximal tibiofibular joint here, it is the synovial joint and the variety of this joint, it is the plain synovial. Distally here, the distal tibiofibular joint is the fibrous joint. This is the anterior view of the right ankle joint. This is the right tibia and this is the right fibula. This is the lateral malleolus and this is the medial malleolus. This is the talus here. The ankle joint occurs between the tibia and the talus. In addition to the articulation between the medial malleolus and the talus and the lateral malleolus and the talus, This type of joint is the synovial joint, and the variety of the ankle joint, it is a hinge joint. This is the posterior view of the ankle joint. Superiorly, this is the tibia. Inferiorly, this is the talus. Laterally, this is the lateral malleolus, and medially here, this is the medial malleolus. The articulations between the tibia superiorly, the lateral malleolus laterally, and the medial malleolus medially, with the talus bone here, it forms the ankle joint. The distal bone here, this is the calcaneum. Foot joints. Posteriorly here, this is the joint between the talus and the calcaneum, is called subtalar joint between the inferior surface of the talus and the calcaneum. This is the joint between the puboid bone and the anterior surface of the calcaneum, is called calcaneopuboid joint. This joint here is called talocalcaneonavicular joint. It occurs between the talus, navicular bone, and calcaneum here. This is articulation between the head of the talus and the posterior surface of the navicular, and this is articulation between the talus and calcaneum. This joint is called talocalcaneonavicular joint. This is the tarsometatarsal joint. It occurs between the tarsal bones and metatarsal bones. This is the tarsometatarsal joint, and this is the tarsometatarsal joint here. This is the tarsometatarsal joint between the puboid bone and the fourth and fifth metatarsal bones here. Those are the metatarsal bones. They articulate anteriorly with the proximal phalanx at those joints here. Those are the metatarsophalangeal joint. It occurs between the head of the metatarsal bone and the proximal phalanx. This is the middle phalanx, and this is the distal phalanx. The joint between the proximal phalanx and the distal and the middle phalanx, between the proximal phalanx and the middle phalanx here. This is proximal interphalangeal joint, and this is proximal interphalangeal joint, and this is a proximal interphalangeal joint. The joints between the middle phalanx and the distal phalanx here, this joint, this one, and this one, this is the distal interphalangeal joint. Coxa varus and coxa valgus. The neck of the femur is inclinated at an angle with the long axis of the shaft of the femur. This angle of inclination equals 160 in young child and 125 in adult male. This is the normal angle of inclination in adult male. This is the long axis of the neck of the femur with the long axis with the shaft of the femur. Here, this is the angle of inclination. It equals 125. Coxa valgus, it is increased in the angle of inclination. It occurs in conditions like congenital dislocation of the hip joint, and coxa varus, it is a decrease in the angle of inclination. This is the coxa varus, in which there is decrease in the angle of inclination. This is the right hip joint from the posterior view. This is the hip here. This is the hip bone, and this is the femur. You can notice that here, this is the long axis of the neck of the femur with the long axis with the shaft of the femur. There is a decrease in the angle of inclination here. You can notice that the head and the neck of the femur become more horizontal here in the coxa varus due to decrease in the angle of inclination. This is the long axis of the neck with the long axis of the shaft. Here, this is the angle of inclination. In the right side of the slide, this is the coxa valgus, in which there is increase in the angle of inclination. This is the right hip joint from the posterior view. You can notice that here, this is the long axis of the head of the femur and neck, and distally here, this is the long axis of the shaft, long axis of the neck. With the long axis with the shaft here, this is the angle of inclination. In this area, you can notice that there is increase in the angle of inclination. Due to increase in this angle, the neck of the femur and the head becomes more vertical. Here you can notice the difference between the coxa valgus, in which the neck of the femur and the head become more vertical, while in coxa varus here, the neck and the head of the femur become more horizontal. Fractures of the femur. The neck of the femur is the narrowest and the weakest part of the bone. It is commonly fractured because it is the narrowest and the weakest part. Fractured neck of the femur is frequently age and sex related. It occurs more in the female than in male. Also, it occurs in the elderly more than in the young adult. Fractured neck of the femur are of two types. Subcapital fracture. This fracture occurs inside the capsule of the hip joint. And trochanteric fracture, it occurs outside the capsule of the hip joint. Fractures of the femur. In the left side here, this is the head of the femur, this is the neck, this is the greater trochanter, this is the lesser trochanter, this is the intertrochanteric line anteriorly, and this is the shaft of the femur. This fracture line here, in this area, we call this type of fracture subcapital fracture. It occurs in the neck of the femur a little bit below the head of the femur. This is the head a little bit below the head of the femur. This is the subcapital fracture. This is the second type of fracture neck of the femur. We call it transcervical fracture, occur through the neck of the femur here. Intertrochanteric fracture. This fracture occurs between the greater trochanter and the lesser trochanter. Subtrochanteric fracture. This is the fracture below the lesser trochanter. This is the greater trochanter and this is the lesser trochanter. It occurs through the shaft of the femur below the lesser trochanter. This is the lesser trochanter. Below it here, this is the fracture line. We call this fracture subtrochanteric fracture. Subcapital fracture, it is the most common type of fracture neck of the femur. In the right side of the slide here, this is the head of the femur, this is the neck, the greater trochanter, the lesser trochanter, and the shaft of the femur. This is the fracture line here. It occurs in the neck of the femur a little bit below the head of the femur. It is intracapsular fracture, that is mean it occurs inside the capsule of the hip joint. It occurs in the elderly. And the cause of the fracture is a minor trip or a minor slip. This type of fracture, the subcapital fracture, commonly in the female after menopause due to thinning of the cortex of the ball. If the fragments are not impacted, considerable displacement occurs. Clinically, we will find that the leg is shortened. The measuring of the normal length of the limb from the anterior superior iliac spine to the medial malleolus. You can measure the shortening of the limb from the anterior superior iliac spine to the medial malleolus, or from the anterior superior iliac spine to the adductor tubercle. You should measure the normal limb firstly, then you measure the affected limb. Also, there is lateral rotation of the leg, the toes pointed laterally. You can notice that the toes pointed laterally, as in this image here. This is the normal limb, and this is the affected limb. You can notice that the toes here pointed laterally. There is a lateral rotation of the leg. A common complication for the subcapital fracture is avascular necrosis of the head of the femur due to disruption of the blood supply to the head of the femur. Trochanteric fracture commonly occurs in the young and the middle age as a result of the direct trauma. The fracture line is extracapsular, that means it occurs outside the capsule of the hip joint. Both fragments of the femur have perfused blood supply. The avascular necrosis here is of no concern. If the bone fragments are not impacted, the pull of the strong muscles will produce shortening and lateral rotation of the leg. Here, this is the normal limb, and this is the fractured limb. The toes here pointed laterally. Here, there is a lateral rotation of the leg. Tibial fracture. The tibial shaft is the most common site of fracture. The junction between the middle third and the inferior third of the shaft of the tibia is the nervous part of the bone. It is the most frequent site of fracture, the junction between the middle third and the distal third of the tibia. This area of the bone had the poorest blood supply. In the right side of the slide here, this is the diagonal fracture with shortening of the limb. This is the right tibia and this is the right fibula. This is the diagonal fracture. Here, this is the transverse fracture through the tibia and fibula. This is the right tibia and this is the right fibula. This is the transverse fracture. This is X-ray of the leg. This is the right tibia and this is the right fibula. This is the transverse fracture through the right tibia and fibula with displacement of the fragment. Bisplanus or flat foot, in which the medial longitudinal arch is depressed or collapsed. Due to collapsing of the medial longitudinal arch, the forefoot is displaced laterally and inverted, and the head of the talus is no longer supported, and the body weight forces it down and medially between the calcaneum and the navicular bone. The causes of the flat foot either congenital or acquired. In this image, here this is the normal foot and this is the normal medial longitudinal arch. This is the footprint of the normal foot. This is the medial longitudinal arch here. You can see it here. This is the flat foot. Here there is collapsing in the medial longitudinal arch, and this is the footprint of the flat foot. Here the medial longitudinal arch, there is no longer clear in the footprint of the flat foot. In this image here, this is the calcaneum, this is the talus and anterior navicular bone. The head of the talus here is forced by the body weight down between the calcaneum and the navicular bone. Biscavus or claw foot, in which the medial longitudinal arch is endally high. Most cases are caused by muscle imbalance. In many instances, biscavus resulting from the poliomyelitis. In the middle here, this is the normal medial longitudinal arch. In the lower part here, this is the flat foot due to collapsing of the medial longitudinal arch. In the upper part here, this is the biscavus due to high medial longitudinal arch. March fracture or stress fracture. It is the fatigue fracture of one of the metatarsal bones. It may occur due to prolonged walking, like in the joggers, soldiers, nurses, and hikers. Most frequently in the distal third of the second, third, or the fourth metatarsal bones. The metatarsal fracture also common in the female ballet dancers when the dancers lost the balance and put their full body weight on the metatarsal bones. This is the dorsal aspect of the bones of the right foot. Those are the metatarsal bones. Distally, those are the phalanges, and proximally here, those are the tarsal bones. This is the first metatarsal bone, second one, third, fourth, and fifth metatarsal bone. This is fracture here in the shaft of the fourth metatarsal bone. Also, this fracture in the shaft of the fifth metatarsal bone. This is a Volscian fracture in the tuberosity of the fifth metatarsal bone. In this image here, this is X-ray of the right foot. This is the first metatarsal bone, and those are the sesamoid bones. This is the second metatarsal bone. This is the third, fourth, and fifth metatarsal bone. There is fracture line here in the third, fourth, and fifth metatarsal bones. This is the tuberosity of the fifth metatarsal bones. This is the cuboid bone here. This joint here, here, and here, those joints here are tarso-metatarsal joint, and distally here, those are metatarsophalangeal joints. This is the end of our first lecture in the lower limb anatomy, the osteology of the lower limb. Thank you very much.